Okay, muscle cramps. Let's talk about them. They can hit you anytime, anywhere, even in your sleep.
Oh, yeah.
Like, I'm sure we've all been there. I know you guys sent in this article from CNA Lifestyle
hmm
called Muscle Cramps. Why do you suddenly get them even while sleeping? Can they damage your muscles?
Good one.
I thought we could take a deep dive into it. What do you think?
Yeah, absolutely. I think there are so many misconceptions about muscle cramps, and I think, this article does a good job of kind of breaking down the science.
Yeah, and I'm particularly curious about why they seem to, like, love to strike when we're least active.
Right.
Like, in the middle of the night. Like, what's going on there?
Yeah.
Are they actually doing damage?
Right.
Those are kind of the two big questions I have.
Yeah.
So why don't we start by defining exactly what a muscle cramp is?
So essentially, it is a sudden involuntary contraction of a muscle or a group of muscles.
Okay.
And it happens when the muscle fibers get overloaded with signals from the nerves.
Oh.
So it's kind of like a misfire.
It's like a communication breakdown between the brain and the muscles.
Exactly, yeah. And this breakdown can be caused by a number of factors, overuse, dehydration, electrolyte imbalances, or even certain medications.
Right.
But what's fascinating is those pesky night cramps.
Yes.
We often seem to have a different culprit altogether.
That's what gets me. It's like if cramps are often associated with overuse, why would they happen when our muscles are, like, essentially at rest?
Yeah, yeah.
It seems very counterintuitive.
That's what puzzled researchers for a while, too.
Right.
But now the leading theory points to the transition between REM and non-REM sleep cycles. So during REM sleep, our muscles are in a state of near paralysis, almost completely relaxed.
Right. That's why we don't act out our dreams.
Exactly.
So how does this relate to muscle cramps?
Well, as we shift from REM to non-REM sleep, our muscles have to quickly, power up again. And this sudden transition, this surge of activity, can sometimes trigger those involuntary contractions, especially in muscles that are already prone to tightness or fatigue.
Interesting. So it's not so much about overuse in this case, but this, like, abrupt change in muscle activity.
Exactly.
Okay. The article also mentions that nocturnal leg cramps are pretty common, affecting about 30% of adults.
Wow.
Do you think there's a connection between age and muscle cramps?
There's definitely a correlation,
Yeah.
but it's not as straightforward as just getting older.
Okay.
So while age itself isn't the direct cause, certain age-related factors can increase our susceptibility to cramps.
Okay. Can you elaborate on those factors?
Sure. So as we age, we naturally experience a decline in muscle mass,
Right.
which is a process known as sarcopenia.
Okay.
So this means that the remaining muscle fibers have to work harder, making them more prone to fatigue and cramping.
Gotcha.
Also, circulation tends to decrease with age, which can affect the delivery of oxygen and nutrients to the muscles, making them more vulnerable to spasms.
That makes
Yeah.
sense. And we also tend to be less active as we get older, which could further contribute to muscle weakness and cramping.
Yeah.
So it's not our age per se, but the physiological changes that come with aging that play a role.
Precisely. And let's not forget about medications. Many commonly prescribed drugs for conditions like high blood pressure or cholesterol can have muscle cramps as a side effect.
Right. So it seems like cramps can strike anywhere in the body. Are there certain muscles that are more prone to cramping than others?
Yeah, you're right. They can happen anywhere, but some muscles are definitely more susceptible.
Okay.
So calves, hamstrings, feet, and hands are common culprits.
Okay.
And interestingly, each of these muscle groups has its own set of potential triggers.
So it's like each muscle has its own, like, Achilles heel, so to speak.
Exactly. So think about your calves, for instance.
Yeah.
They work incredibly hard all day supporting your body weight and propelling you forward with every step. So they can become particularly tight from things like prolonged sitting, standing, or wearing high heels.
I can definitely relate to that. My calves are always the first to complain after a long day on my feet.
Right, and because they're often in a shortened position, they're more vulnerable to those sudden involuntary contractions.
Okay.
Similarly, hamstrings can become tight from sitting for long periods, or from activities like cycling or running.
Right. The article also describes various sensations associated with cramps, like tightening, twinging, and seizing.
Right.
Is there a reason why cramps can feel so different from each other?
That's a great observation. It all comes down to the severity and duration of the muscle contraction.
Okay.
So a mild cramp might just feel like a slight tightening or a twinge.
Yeah.
whereas a more intense one can feel like a full-on seizure lasting for several minutes and leaving you with residual soreness.
Oh, wow. Okay. So let's say a cramp hits, and we know it will eventually. What's the most effective way to deal with it in that moment?
So the key is to interrupt that involuntary contraction and relax the muscle.
Okay.
And the most effective way to do that is to gently stretch the cramping muscle in the opposite direction of the contraction.
So if my calf is cramping and forcing my foot to point, I should try to pull my toes up towards my shin.
Exactly. That counter stretch helps override the signal that's causing the muscle to contract, allowing it to relax and lengthen.
Oh, that's a great tip. Are there other things we can do to, like, relieve the pain and discomfort?
Absolutely. So applying heat to the cramping muscle can help relax those muscle fibers,
Mm-hmm.
while ice can be used afterward to reduce any pain and inflammation.
Oh, okay.
And of course, replenishing electrolytes is crucial. So consider an isotonic drink
Okay.
or something like a banana, which is rich in potassium.
Right. These are all super helpful tips.
Yeah.
But the question that's on my mind is, do cramps actually damage our muscles?
Yeah.
Like, it certainly feels like they could be causing some serious harm in the moment, you know?
Yeah, I understand the concern. But the good news is that, in most cases, muscle cramps are benign.
Okay.
They don't cause lasting damage to the muscle fibers themselves.
Okay.
The pain and discomfort you feel are primarily due to the intense contraction and the temporary restriction of blood flow to the area.
Oh, okay. That's a relief to hear. But what about that lingering stiffness and soreness we often feel afterward?
That's simply your muscles recovering. The intense contraction can create tiny micro tears
Okay.
in the muscle fibers, and the soreness you feel is part of the natural healing process. It's kind of like delayed onset muscle soreness from a workout,
Right.
but on a smaller scale.
So it's like our muscles are saying, hey, we worked hard, gives a little TLC.
Exactly.
Yeah.
But it's also important to recognize that while most cramps are harmless, there are instances where they could be signaling something more serious that requires medical attention.
Okay, that's an important point.
Hmm.
What are some red flags that should prompt us to see a doctor?
If you experience frequent severe cramps, especially if they're accompanied by other symptoms,
Okay.
like weakness, numbness, discoloration, or swelling in the affected area, it's definitely worth getting checked out.
So basically, if it goes beyond the typical cramp experience and something feels off, it's best to err on the side of caution.
Absolutely. Persistent or unusual cramping could be a sign of underlying issues ranging from circulatory problems and nerve compression to mineral deficiencies or even certain muscle diseases. So, it's always better to be safe than sorry.
This has been incredibly insightful. We've learned about the causes of cramps, the different sensations they can produce, and how to treat them effectively. But can we actually do anything to prevent these muscle spasms from happening in the first place?
There are definitely proactive steps that you can take
Okay.
to lower your risk. One of the most effective strategies is regular stretching.
Right.
It helps lengthen those tight muscles, improve flexibility, and reduce their susceptibility to cramping.
That makes sense. Like, if our muscles are used to being stretched and move through their full range of motion, they're less likely to protest when we ask them to do something,
Exactly. And it's especially important to stretch before bed,
Oh, okay.
as those nighttime cramps are often linked to muscle relaxation during REM sleep. A few gentle calf, hamstring, and quad stretches before hitting the hay can make a world of difference.
So incorporating stretching into our daily routines is crucial.
Mm.
But what about diet and hydration?
Yeah.
Do those play a role in preventing cramps?
Absolutely. Making sure you're getting enough electrolytes is essential.
Right.
Electrolytes like sodium, potassium, magnesium, and calcium play a vital role in muscle function and nerve transmission.
Okay.
When we're depleted of these electrolytes, our muscles become more excitable and prone to cramping.
So what are some good sources of electrolytes?
You can get electrolytes from a variety of foods, such as bananas, leafy greens, dairy products, and nuts. But if you're particularly active or prone to cramping, you might consider electrolyte-rich drinks or supplements.
What about hydration? We know that dehydration can lead to muscle cramps, but how exactly does that happen?
When we're dehydrated, the volume of our blood decreases, which in turn reduces the flow of blood and oxygen to our muscles.
Okay.
This can make them more susceptible to fatigue and cramping.
So staying hydrated is essential for maintaining muscle health
Yeah.
and preventing those painful contractions. What about the role of specific electrolytes?
So each electrolyte plays a unique role.
Okay.
For example, magnesium is crucial for muscle relaxation, while potassium helps regulate muscle contractions.
Okay.
Calcium is involved in both muscle contraction and relaxation. So when these electrolytes are out of balance, it can disrupt the delicate communication between nerves and muscles, making cramps more likely.
So it sounds like maintaining a balanced electrolyte intake is key,
Mm-hmm.
both through our diet and potentially through supplementation.
Exactly. It's all about listening to your body and finding what works best for you.
And let's not forget about the importance of uh, staying active in general.
Right.
Like, if our muscles are used to regular movement and exercise, they're less likely to complain when we push them a bit.
You got it. Regular physical activity helps build muscle strength and endurance, making them more resilient to fatigue and cramping.
Okay. This is all incredibly helpful. I feel like we've covered a lot of ground in this first part of our deep dive into muscle cramps. We've debunked some common myths, gained a deeper understanding of the causes and triggers, and learned some effective strategies for both treating and preventing them.
We've only just scratched the surface. There's so much more to explore about this fascinating phenomenon.
Stay tuned for part 2 of our deep dive, where we'll delve even deeper into the science of muscle cramps and uncover even more surprising insights. So before we dig deeper into the science behind muscle cramps, I'm really intrigued by this concept of cramp awareness that the article mentions.
Yeah.
Is that something you can shed some light on?
Yeah, it's a fascinating idea, isn't it?
Yeah.
Cramp awareness is essentially about paying close attention to your body's signals
Okay.
and recognizing that muscle cramps can provide valuable insights into your overall health and well-being.
So it's not just about treating the cramp itself, but also trying to decipher, like, what it might be telling us about our bodies.
Exactly. Think of cramps as a form of communication from your muscles.
Oh, okay.
They can be a sign of dehydration, electrolyte imbalances, muscle fatigue, nutritional deficiencies, or even underlying medical conditions.
That's a really interesting way to look at it.
Yeah.
Instead of just seeing cramps as a nuisance, we can view them as an opportunity to learn more about ourselves
Yeah,
and potentially address any underlying issues.
right. It's all about tuning into those subtle cues and understanding the different messages your body might be sending.
So what are some examples of how we can apply this concept of cramp awareness in our, like, daily lives?
Let's say you consistently get cramps in your calves after a run. This could be a sign that you need to pay more attention to your pre-run stretching routine, hydrate more effectively, or even consider adjusting your running form
Okay.
to reduce the strain on your calf muscles.
Or if you're experiencing, like, frequent night cramps,
Mhm.
it could indicate a need to focus on, like, your electrolyte intake,
Yeah,
particularly magnesium,
yeah,
which plays a vital role in muscle relaxation.
precisely. By paying attention to the frequency, location, intensity, and timing of your cramps, you can start to identify patterns and potential triggers.
Right.
This awareness can then guide you towards making adjustments to your diet, exercise routine, or lifestyle habits
Okay.
to help prevent future cramps.
It's almost like turning those, like, annoying muscle spasms into, like, valuable data points
Right.
that we can use to optimize our health.
Exactly. It's about empowering yourself to take control of your well-being
Right.
and proactively address any imbalances that might be contributing to your cramps.
This concept of cramp awareness really resonates with me.
Yeah.
It's about shifting our perspective and seeing those cramps as an opportunity for growth and self-discovery, rather than just a painful inconvenience.
I'm glad to hear that.
Yeah.
It's all about transforming our relationship with our bodies and learning to appreciate the subtle messages they're constantly sending us.
Okay.
Yeah.
Let's shift gears a bit and delve into some of the specific scientific mechanisms
Okay.
behind muscle cramps. We've talked about the role of electrolytes, but can you explain in more detail how these minerals influence muscle function and contribute to cramping?
Of course. So electrolytes are essential for regulating nerve impulses and muscle contractions.
Okay.
They help maintain the proper balance of fluids inside and outside of our cells, which is crucial for muscle function.
So when our electrolyte levels are out of balance, it can, like, disrupt this delicate communication system
Yeah,
between nerves and muscles.
exactly. Let's take magnesium, for example.
Okay.
Magnesium is a key player in muscle relaxation. So when your magnesium levels are low, your muscles may become more excitable and prone to contracting involuntarily, leading to cramps.
That makes sense. And what about potassium? I know that's another electrolyte that's often associated with muscle cramps.
Right. Potassium plays a crucial role in regulating muscle contractions and maintaining the proper electrical balance within muscle cells.
Yeah.
When potassium levels are low, it can disrupt this balance, making muscles more susceptible to spasms and cramps.
And calcium. I know it's essential for bone health, but does it also play a role in muscle function?
Absolutely. Calcium is involved in both muscle contraction and relaxation. It acts as a trigger for muscle contraction, but it also helps to regulate the relaxation process.
Okay.
When calcium levels are imbalanced, it can interfere with this delicate interplay, making cramps more likely.
So it seems like maintaining a proper balance of these electrolytes is crucial for healthy muscle function
Yeah.
and preventing cramps.
Precisely. And this balance can be influenced by a variety of factors, including our diet, hydration levels, exercise intensity, and even certain medications.
You mentioned that certain medications can impact electrolyte balance. Can you give us some examples?
Sure. Diuretics, which are commonly prescribed for high blood pressure,
Okay.
can deplete the body of potassium.
Okay.
Similarly, some medications used to treat heart failure can affect magnesium levels.
That's important information to be aware of.
Yeah.
So it's always a good idea to talk to your doctor about any potential side effects of medications, especially if you're experiencing frequent muscle cramps.
Absolutely. It's always best to have an open dialogue with your healthcare provider about any concerns you might have.
Let's talk more about the role of hydration in preventing cramps. We know that dehydration can make us more susceptible to cramping, but can you explain the underlying mechanisms involved?
Sure. When we're dehydrated, the volume of our blood decreases, which in turn reduces blood flow to our muscles.
Mhm.
This can lead to a buildup of metabolic byproducts, such as lactic acid, which can irritate muscle fibers and trigger spasms.
So it's not just about the lack of water itself,
Right.
but also about the impaired delivery of nutrients and removal of waste products from our muscles.
Exactly. Dehydration creates a less than ideal environment for our muscles to function optimally,
Yeah.
making them more vulnerable to cramping.
The article also mentions that strenuous exercise, especially in hot and humid conditions, can increase the risk of cramping.
Right.
Why is that?
So when we exercise intensely, especially in the heat, we lose electrolytes through sweat.
Yeah.
This electrolyte depletion, combined with the increased demands on our muscles, can disrupt the delicate balance needed for proper muscle function, making cramps more likely.
So it's a combination of factors:
Mhm.
electrolyte loss, muscle fatigue, and the added stress of heat and humidity.
Exactly. It's like a perfect storm for muscle cramps.
So what can we do to mitigate this risk?
Hydrating properly before, during, and after exercise is crucial. And if you're exercising intensely or for prolonged periods, especially in hot weather, consider electrolyte-rich drinks or supplements to replenish those lost electrolytes.
That makes sense. And what about the role of stretching in preventing cramps?
So regular stretching helps to maintain muscle flexibility and range of motion,
Okay.
which can reduce the likelihood of cramps.
Yeah.
Think of it as preparing your muscles for the demands you're going to place on them.
I imagine it's like warming up a rubber band before you stretch it. Like if it's cold and stiff, it's more likely to snap.
That's a great analogy.
Yeah.
Stretching helps to loosen up those muscle fibers, making them more pliable and less prone to sudden involuntary contractions.
Okay. This has been incredibly insightful. We've explored the role of electrolytes, hydration, exercise intensity, and stretching in the development and prevention of muscle cramps. Is there anything else you'd like to add before we wrap up part 2 of our deep dive?
I think it's important to emphasize that while muscle cramps are generally harmless, they can be a sign of an underlying medical condition in some cases. So if you experience frequent, severe, or persistent cramps, especially if they're accompanied by other unusual symptoms, it's always best to consult with your doctor to rule out any potential medical issues.
That's great advice. It's always better to err on the side of caution when it comes to our health.
Yeah.
Well, this has been another fascinating segment. We've learned so much about the intricate workings of our muscles and the factors that can contribute to cramping. I can't wait to delve into even more insights in part 3 of our deep dive.
I'm looking forward to it as well.
Yeah.
We've only just scratched the surface of this fascinating topic.
All right, welcome back to the final part of our deep dive, muscle cramps.
Yeah. It's been quite a journey. Exploring these sudden, often painful muscle contractions.
Yeah, it really has. We've learned so much about the causes, the triggers, the treatments, and even how those cramps can offer valuable insight into our overall health.
Right, and we've busted some myths along the way.
Totally.
Like the idea that cramps always signal serious damage or they're solely a consequence of aging.
Right. It turns out those intense contractions, while certainly unpleasant, are, usually benign. They don't cause any lasting harm. And while age-related factors can increase our susceptibility, they're not the root cause.
Exactly. We've also discovered that there are things we can do to minimize those crampy episodes.
For sure. From staying hydrated and maintaining a balanced electrolyte intake to incorporating regular stretching and warming up properly before exercise, we have like a toolkit of strategies to keep those cramps at bay.
And even when they do strike, we've learned some effective ways to manage them
Yeah.
in the moment, like counter stretching, applying heat and ice, and replenishing those lost electrolytes.
But perhaps the most valuable takeaway for me has been this idea of becoming more cramp aware.
It's a powerful concept, isn't it?
It really is. Instead of just dreading those muscle spasms, we can view them as opportunities to understand our bodies better and address any underlying imbalances that might be contributing to them.
It's about shifting our perspective
Mm,
and seeing those cramps as a form of communication from our muscles, a way for our bodies to tell us that something might be off.
And by paying attention to the frequency, location, intensity, and timing of those cramps, we can gain valuable clues about our overall health and well-being.
It's like turning those annoying muscle spasms into helpful whispers from our bodies,
Yeah,
guiding us towards better health.
exactly. So as we wrap up this deep dive, what are some final thoughts or key takeaways you'd like to leave our listeners with?
I think the most important message is knowledge is power. The more we understand about our bodies, the better equipped we are to take care of them.
Absolutely, and that includes understanding those sometimes mysterious muscle cramps.
Right. By understanding what causes them, what triggers them, and how to both treat and prevent them, we can take control of our muscle health and minimize those crampy interruptions.
And perhaps even learn something valuable about ourselves along the way.
Exactly. It's all about embracing a proactive approach to health and well-being
Yeah.
and viewing those cramps as an opportunity for growth and self-discovery.
This has been such an insightful and empowering deep dive. I feel like I've gone from dreading cramps to actually appreciating them for the valuable information they can provide.
That's fantastic to hear. And
Yeah.
remember, this is just the beginning of your cramp awareness journey.
Right.
Keep exploring, keep learning, and keep listening to your body.
Well said. And to all of you listening, we hope you've enjoyed this deep dive into the world of muscle cramps. Until next time, stay curious, stay informed, and stay cramp aware.